Hey everyone, my name's Lavonne and welcome back to my YouTube channel. I always say this that I'm so excited, but this is like the most special episode I feel like I've brought as far as a collab to my channel to date. I am thrilled that you get to learn from Krysta Dancy. I'm going to let her introduce herself, but she is a trauma specialist. That's what I'm going to call her, and our resident trauma-informed care educator, expert, extraordinaire for bundle birth. She trains our labor and delivery nurses. She's a part of our mentorship program, and she is an incredible resource to us as a company. I'm going to say for bundle birth, but then also for you today. So I'm going to let her introduce herself, but today we are going to talk all about trauma. What is trauma? Who has trauma? How does it affect you? And then is there hope for you? And then we're going to come back for part 2. So make sure you subscribe down below, because in part 2, she's going to give us some body-based techniques to help down-regulate our nervous system. You're going to learn what that means and cope with stress. So again, make sure you subscribe down below. Make sure you follow us over on Instagram. I'll link everything in the description box down below. But then without further ado, let's get started. Before we start talking all about trauma, I want to give you an opportunity to introduce yourself, Krysta, and let them know everything you're doing. Guys, this is like the premier expert in trauma-informed care for birth. She's very humble and sweet, but really, truly, I have read and done a ton of work on trauma. I've taken lots of different classes, and I can say that Krysta's work is the best of the best. And so today, if you're tempted to walk away, just put this on 1.5 speed and clean your house or do your laundry or something while you listen to this conversation, because I know it's going to be so valuable to you. So with that, Krysta, why don't you just introduce yourself and let us know a little bit about your background, because until I met you and got into this work, I didn't really know there were trauma therapists. And then with that, we're going to start having the conversation about what is even trauma in the first place.
Well, first of all, thank you. I mean, how do I follow that introduction? I feel like that was so wonderful and lovely.
Oh, well, it's true.
Thank you. I love working with bundle birth. So yeah, you kind of covered it. I have been a therapist for close to 20 years. Early in my career, I was super lucky in that I was just kind of like seeing everybody in a nonprofit, and I started seeing combat veterans in my practice. And that was really my first introduction into the topic of trauma. They were my first teachers. I'm so grateful to them and so lucky that I had that education. So what ended up happening was this interesting thing where, as I became a mom myself, I started to also have moms in my practice. So I always say, like, the early days of my therapy work was so special to me because my office was filled with like combat veterans, some of them in uniform, and then moms like nursing babies in the waiting room, and they were kind of side by side. Yeah, to me, it was like so great. I actually loved the energy of that. But something stood out to me, which was I started to see new moms, and some of them had symptoms that were in some ways similar to the PTSD symptoms I was seeing in my veteran clients. And this was, again, like 20 years ago. My Google game wasn't strong. I'm not even sure if I had Google. I definitely didn't have access to like PubMed and all the publications on this. So I was just at a loss. I was like, what am I going to do? I love working with this group, but I want to find a place to send them, a book to recommend, stuff they can read. Like, what am I going to give them? And the truth is, I just came up really empty-handed. So, like a lot of us, I was like, I guess I better figure it out. And that was the beginning of, I got to figure out this trauma and birth overlap. So since then, it's been my passion. I deal both with traumatic birth, but also deal with people have trauma like leading into birth, because that can really affect the way you experience birth, right? And the larger picture of like trauma in the birth room, including for professionals as well. So that's like my whole little nerdy niche, is how trauma affects the body and how trauma affects birth experience and all of that. That's what I love.
So then that leads me into the perfect question of, what do you define trauma as? Because I think in like the regular world, we hear the word PTSD, or they have PTSD, or we see it in the movies, like especially with war movies of them having trauma or flashbacks or whatever. So then how do you define trauma? And then how does that relate to a birthing person? Because if you're going to relate a combat veteran, you're seeing the same thing from like a veteran to a mom.
Yeah.
Like where are the parallels?
Like, what's going on there? Okay. So there's a lot. I mean, so I just have to start by saying, if anybody's interested in this topic, there's so much written on it. I like to keep things simple. I think it's easier to remember if it's simple, and I think it's more useful if it's simple. So I'm going to oversimplify here. Okay. Here's what a normal memory is, because trauma is really about memory formation. So normal memory, you go to have a dinner someplace you think is delicious and you love it. And for a short time after that dinner, you can remember like every sizzle, every smell, the way the waiter behaved, the music that was playing, the decor, like all of it's very strong, not just in your mind and not just in your memory, but it's also very strong in your body. For instance, if I was like wanted to, and I could measure salivation, you'd still salivate to remember the meal for a time after. You would have physical markers of the memory for a short time after it. But normal memory, you go to sleep that night, it starts to fade. A few days later, it fades more. A few weeks later, more. And by a few months out, unless something really interesting happened at that dinner, you'd be hard pressed to remember the specifics of it. And if you did remember, it would just be fact. It'd be like, oh yeah, I went there. I really liked it. They have a good, whatever your favorite dish is. But it's factual. And that bodily reaction fades with time. That's normal. That makes room for new memories in your brain. We can't hold everything in this like working active memory space. Okay. Traumatic memory compared to normal memory starts out the same, where it's visceral and you have a bodily response to it, but time doesn't fade it. And that's the hallmark of a traumatic memory versus any other memory. So one of the things that's important is trauma is not the same thing as difficult, right? Difficult, we can do difficult. We're resilient. We're meant to do difficult. Totally. Something that's difficult, we like look back on it and go, that really sucked, but man, I'm amazing that I survived that, or I'm glad it's behind me. And we don't have much of a reaction to it. Traumatic memory, the way that we as like non-professionals can say, hey, how do I know if I have trauma? Notice if you have a bodily reaction to the memory of it. And what that looks like and feels like is your heart rate goes up, your breathing goes up. You might feel dizzy. You might feel a tightness in your chest. You might feel overwhelmed. You might feel shut down. So when you have a bodily reaction and you have what we call intrusions, meaning the memory is intrusive in some way, that can be dreams. That can be full flashbacks, like what you see with a severe case in like combat veterans in the movies, where they're like replaying the whole experience. Yeah. But it can also be more subtle. So an example of this is somebody who was in my office who had a traumatic birth. They were fine until they went to their postpartum checkup, and they walked into the bathroom and started to wash their hands before the appointment. And the smell of the soap was the same soap used in the hospital. And all of a sudden, the smell of the soap, They felt nauseous. They felt like they were a little bit dizzy. They felt flushed, right? And were having a bodily response. So one of the things that I want people to know is, even if you're not replaying it, it can still be trauma if you're having this body reaction. And then a final sign that you might be having it is if when you start to think about the experience, it's hard to make it stop. That's an example of an intrusion. It's like people go, drop it, just it's in the past, let it go. And you're like, I want to let it go. But like as soon as something reminds me of it, it's almost like this movie that this memory that I cannot drop. I can't get it out of my brain sometimes until I play it all the way through, or until something else finally distracts me, or whatever it is. But it doesn't feel like voluntary. Like I don't want to be thinking about it and I can't seem to stop.
Right.
Yeah.
So what I love about this and your approach that's been so revolutionary for me in my practice is the recognition that this is like physical symptoms. Like I think the stigma with anything mental health or brain related anxiety, trauma, depression, whatever, is like, just figure it out. Like you should just work harder, just forgive and forget, or get over it. But what I'm hearing is this isn't a just get over it. It's literally uncontrollable body response that can manifest in many ways.
Yes. And not only that, it's actually your brain trying to protect you. It got the instructions mixed up. It's trying really hard. Basically, what your brain said is that thing that happened was so terrible that anything that seems to be signaling that it's about to happen again, we are going to have a big reaction to, so that we're protected, right? And so that's what a trigger is. It's like people who've had a traumatic car accident, for instance, and then the same song comes on the radio. Intellectually, they know that song didn't cause the accident, but their nervous system, their brain goes, last time we heard this, something terrible happened, and you're filled with fight and flight because your brain wants you to stay safe. It's trying very hard, but for a bunch of nerdy reasons, it just did not get the memo that this is past tense. It did not get the memo that we're not in danger anymore, and like we can just chill and we don't need to be on high alert. And so it's like a switch that got flipped on, and it's staying on high alert, and it's looking for signs of that danger repeating. And so
it's like sweet,
Yeah,
but
it's like, no,
also like,
well, brain, you're trying.
yeah.
I just talk about it with my clients. Like I think about it like a puppy dog who's like trying to be a good guard dog, but it just isn't gotten the memo. It's like, grrr, like this is a danger, and it's like
Yeah.
trying really hard, but it's like barking at the wrong thing,
Yeah.
right?
Yeah.
Like the song isn't dangerous. We don't need to bark at the song, but your brain is like, we're not convinced.
Mm-hmm.
So what I say to people is like, people say, well, just be grateful you lived, right? Or just be glad it's
You have a
over.
healthy baby.
Right, you have a healthy baby, or look on the bright side, or use your faith to recover from it. And the truth of the matter is, you can be grateful and have trauma. You can have great faith and have trauma. You can be an optimistic person and have trauma. You can be a strong person and a resilient person and have trauma. Remember, I worked with some of the toughest people in the world who had trauma. Is not a failure of strength. It's not a failure of optimism. It's your central nervous system's just having a response. It's just a response. Your brain didn't get what it needed. That's all.
Mm-hmm. Mm-hmm. Which leads me to, what does your brain need? But let's table that, because I want to relate this to birth. So you're seeing this in your office with birth, right? It talk to me about what you see related to birth, because one of the things that I say on my channel is like, I believe that education, actually, I know that education is protective against trauma in the birth room. And I think what I've seen is people be like, I could be traumatized. But if you think about it, like, think about the stories that people tell, or like, it was so awful, or they can't even tell their birth story.
Yeah.
So my question for you is, to you, what does birth trauma look like, or trauma from your birth experience? Is this a thing? And then how do you know if you have it?
Yeah. So since the early days when I was like, what in the world am I looking at? Now we have a lot of research that's being done on this. And we know that statistically, 30%-ish of people after birth have some trauma symptoms, but a smaller percentage have fully diagnosable PTSD. So it is a thing, and it's actually not that uncommon. And that might sound scary to people. So why am I like going around telling everyone? I'm going around telling everyone because number one, it's preventable. Number two, it's highly, highly treatable. Like in a very short amount of time, if you get the treatment that you need, your brain gets what it needs to deconstruct that experience. You can like move forward with it behind you. So I'm wanting to get the word out that there's so much reason to be hopeful. We know more now than we even knew 5 years ago about this issue. What we're able to do is incredible. And so people should know, if they recognize themselves in these symptoms, that this is like actually good news, because it's very treatable. And so if you are like, you know what, I'm not doing okay, but I'm not sure exactly what's wrong, and then you start to notice, oh, these symptoms seem like trauma, instead of being like, oh my God, I'm screwed, I want you to think like, oh, I know what to do. Because again, you can handle this. So ways that people might know is, again, it's the intrusions. So you're finding yourself ruminating on your birth experience. You're finding that you're replaying it. You're finding that you're dreaming about it. Right. And sometimes what that can mean, a really common one in the early days, is this startle awake thing that will happen, where as the brain starts to transition into REM sleep, suddenly there's like a flash of a sound or a smell or a picture, and you'll startle awake with this adrenaline response. That's an early sign. Immediately after birth, an early sign is like shock, which just looks like totally overwhelmed and glazed over, like not really tracking, slow to respond to what's happening in the room where normally you wouldn't be. Those are some signs really early postpartum. Disturbed sleep, even just like struggle to go to sleep, because other than like baby waking you, because obviously everyone's sleep is disturbed, but meaning even when it's like the perfect conditions for you to sleep, you're still struggling because what you're trying to do is down regulate. Right. So these are like early signs of my brain is needing a little help to process the experience that I just had. Right. And that this would be a good time. Here's the other side of the coin. And this is a little less common, but I think it's worth mentioning because I see it more often with people with pre-existing trauma, which is, instead of going into a state of highly alert and like, like a startle response, somebody makes a loud noise and you jump, baby cries and you tense, you're trying to sleep and you startle awake. That's one side of the coin of the nervous system. The other side is a flattening or dissociation, where you find that you're sort of like staring, you're disconnected, you're checked out, you're struggling to feel your body or feel your emotions. For trauma survivors, people who came into birth with previous trauma, that's like another way that it can look. They both are the brain trying to protect you. It's just based on the unique features of you and your life experiences, it decides to go one way or the other. But if you see either of those things in the early stages, then you know, great, okay, I know what to do.
Okay. So then do you have to have a perfect birth, or sorry, do you have to have a like emergency situation to have birth trauma?
Such a good question. Absolutely not. So glad you asked that. Yeah. So I think that that's something that it makes part of the reason I didn't understand it initially, honestly, was because I believed that that would be the only thing that made sense. Right. Which is like, because that's what I'm being taught in school. You have to have, like, at the time, the diagnostics manual, like what we're being taught in school is you or a loved one have to be close to death. And I think the thing is, obviously, if there was an emergency birth where you or your baby were in danger, then I think we intellectually can say trauma, we get it, right? But
Totally.
that's not the only pathway to trauma. There are other pathways, including how you feel about the care that you received, how you feel about the treatment you received, how you were in. I mean, there's all kinds of things in terms of like a level of pain can be really connected to a traumatic experience, whether the pain was controlled in a way that you expected, how supported you felt. Because remember, again, trauma is not the same as difficult. So we're not comparing what's more and less difficult. That's not the important thing. The important thing is whether your nervous system and your brain got what it needed to be able to say, that was hard, but it's in the past, versus your brain is like, nuh-uh, this is still really not okay for us, right? And I'm going to keep protecting you from it until I get the message that it's in the past. So
Right.
what I want people to understand is what I see in my office. I see a pretty even split. Some of them are there because they had these, crisis emergency situations, but at least half of them are there because of something that I would call like more subtle, less obvious in the way that they feel about the care they received, or what they feel about the people in the room, or what they feel about support, or just other kind of grab bag, how they feel about like perhaps their pain management or the way their body responded, or previously existing trauma that impacts how they experience the birth.
Mm-hmm.
Yeah.
So you say that your brain needs something, and like your brain didn't get what it needs.
Yeah.
What does the brain need in order to avoid trauma?
Such a good question. So I teach like a whole class on what your brain needs.
We're giving the Sparked Notes version, and we'll link her classes down below because they are available.
They are available, and it's like the focus of my work, right? Because the point is not to just be like, oh, ho hum, this is all bad news. It's
Right,
not
right.
bad news. Like, we know what to do. And especially if here's my plug, if you're somebody who like works in birth, we know what to do to help with this. So this is not like oh, bummer.
Yeah.
We're just powerless to do anything about it. Good luck to all of you at all. But let's, for the sake of like the people listening today, the really short version of it, if you had a difficult birth experience, there's a few things that I'm going to recommend that you prioritize in the days and weeks right after it. Okay. The first one, everyone wants to throw stuff at me, but I still think it's so important because it's so supported by all of the evidence, which is you need to get the support around you to prioritize your sleep to whatever extent you can. What we see is that there's a very direct correlation between disturbed sleep and PTSD, to the point that some people have theorized PTSD might actually be a symptom of a sleep disorder instead of the other way around. We haven't decided on that yet, but I just think it's important to say, like, it's that crucial. So some of the best therapies actually use a similar technique to what we get naturally in REM sleep, rapid eye movement, when the eyes move back and forth. That is a time that our brain is processing experiences, which is why often your sleep is disturbed when you have trauma. So what people do when they don't know this is they often do the exact opposite of what they need to do, which is they go to sleep, their sleep is disturbed, they have dreams, they startle awake, they hate it, so they start to avoid it, right? They start to dread it. And so it compounds because now they're not getting the thing their brain needs in order to process the experience. So even if it requires reaching out to your provider to say, I need help sleeping, I need medical support to sleep, in the first few days, get the support that you need from loved ones in order to make sure that baby's needs are taken care of and that you're doing what you need to do. If you still want to keep nursing or whatever, that they're help supporting you in that, but prioritize sleep in the beginning. When number two, when you are recovering from a difficult birth, this is not an exercise recommendation. So this is not like get out there and work up a sweat. Gentle side to side movement, again, utilizes that same natural brain state as REM sleep. So gentle walking, gentle swimming, gentle yoga, gentle dancing. This is not about like we're trying to build muscle and work up a sweat. Your body's been through a lot. This is about we're trying to give your brain what it needs. And this sort of side to side is really important for that. And we'll talk more about that in part 2. But if people don't get to that, so sleeping, moving. And then the third thing that I say for people is one of the ways you can signal, we have to speak the language of the body, right? We can't talk ourselves out of trauma. If we could, we would. We can't be like, stop it, brain. It's not a danger anymore. Don't do it. Doesn't work.
Totally.
The brain does not listen to us. Doesn't speak language. So we speak the language of the body. We speak the language of the body to show our body that we are now safe. Hey, listen, body, we're safe now. We don't have to keep doing this. So anything that you can do that brings on a feeling of safety and coziness, do it. Do it every day. Help yourself do that. Some examples of this would be that people don't think of often: eating regularly, right? Because when we're eating regularly, what we're signaling, we're speaking the language of the brain. Often appetite's disturbed right after a trauma. When we start eating regularly, what we are doing is telling our body, hey, look, we must not be being chased by a bear, because if we were chased by a bear, I wouldn't stop for a snack. So we must be okay, right? We're sending a message like we are safe. Our needs are being met. Drinking water, eating, gentle side to side movement, sleep. And then finally, if there's a safe person, that you can talk about your experience with. And what I mean by safe is somebody who's not going to try to shame you or correct you, argue with your version of events, but somebody who's truly just going to listen compassionately. What I've seen in the literature, if you can have that empathic conversation with somebody within about 4 to 6 weeks of your birth, you greatly decrease the chances that it's going to go on to become trauma, because your brain needs that in order to process it. So you know how like when we've had a rough day, we just like want to vent, right? We just like want to call our friend and like vent. Turns out there's like a brain reason that we do that, because when we put our experiences into language, it helps us reprocess it. It helps us go, it's like a reboot, right? It's like your brain goes, no, let's try that one again. Yeah.
Like I got it out, and then it's like out and gone. I think about that when I vent.
Yeah. Oops. Yeah. You get it out and it's out and gone. Also, when you get it out, you have to, it's like so nerdy, but you have to put it into certain parts of your brain to put it into language. So you're taking it out of the re-experience and you're putting it into the language centers of your brain. Then you're hearing what you're saying. So you're processing it through the listening centers of your brain. So about 6 to 10 hours later, when the memory goes back into long-term storage, it's been shifted. It's been altered. It can be integrated better. So it actually helps us feel like more settled with it. In real ways you could actually measure if you were watching the brain.
And this is not with a therapist. Like we're talking like a friend, a mom, a partner, maybe, you know, that like you don't have to go to therapy. You just need to talk about it.
Yes. Yeah. And actually what we see in the literature is that it doesn't, I think this is part of, I mean, I'm obviously a big fan of therapy, but like what I want people to know is if you don't have access to that, it's okay. Because if you can do it within that 4 to 6 week window of the experience, like if somebody will just listen with kindness to your story, it is so helpful. And anybody listening who's like supporting somebody, you know, push play, like have them listen to this part of it. If you can just listen with empathy, don't correct it, don't challenge it, don't try to change how they feel about it, just listen and reflect, right? Give supportive statements. You often feel like as a loved one, like I'm not doing enough. Like I want them to feel better. How am I going to make them feel better? Literally listening is huge. Yeah.
I love that. So there's hope is what I'm hearing.
So much hope.
There's like actual like physical things that you can do. It's like, because I think a lot of times too, I think one of the misconceptions of anything related to the brain is that I have like, you must go to therapy. Therapy is the answer. And that like, it's all in your head kind of, and that like, it's not quite as physical. I think that's the transition I've personally made from working with you is like, wow, there's like, these are body-based techniques. These are like going on a walk, walking it off, you know, that you're actually stimulating the brain in a different way to help process the traumatic memory. So it doesn't turn into a long-term effect.
That's right. Right. Absolutely. Yeah. And so, I think what's cool about, I think that what's cool about that is, you know, we have this really outdated idea where we like separate the body and the brain and our emotions as if they're these separate things that just interact with each other. But all of the evidence and all of the research, and as we get better technology that allows us to measure things like brain and body and emotion, right? What we learn more and more and more is like, there is no such separation.
Yeah.
Right.
Yeah. We're all working together. And if you can, it's almost like brain hacking right now. You're like hacking your brain to be like, no, I'm actually smarter because my body's going to tell my brain versus my brain's going to tell my body.
Absolutely right. Like we're going to help that little puppy dog who got a little lost. Like we're not letting the puppy dog run the show. Come here. Let me help you out.
Yes. 100%. So I guess that to me answers most of the question related to the like birthing person side of things. I don't want to forget that there's other people in the room, so we're going to go there. But before we do, I want to make sure and let you all know that in the description box down below is all of her classes. They are mostly for birth workers. So if you are a doula, a doctor, a nurse, and anybody in the medical field, but I will say that if you can just adapt the content for your own personal life, I think there's still a lot of value there, including her grounding techniques class. So I have to say that because there's more. If you want more, there's so much more, and her whole class is available to you. So there's that.
We can geek out on this subject for a long time. I got so much to say. There's so many tools, so many tricks, so many fun things we can do.
Totally. Well, and if you don't follow me on Instagram, we did do a series on Instagram where we talked about trauma in other ways as well. So you can check that out over there, and then make sure you follow her. Side note. So with that, we talked about the birthing person, but can other people have trauma from other people's births?
Yes.
I know the answer to that.
The answer is yes.
Go there.
Yes. Okay, awesome. So I'm so glad that you bring this up, because I think that it's as little as it's being discussed that people can have trauma from birth, it's being discussed even less that other people can have trauma from the birth. So for instance, one thing I see in my office that is often not talked about is that the partner can have trauma from the birth experience. And sometimes, so there's research only being done just now on this very, very beginning stages. We don't know a lot about it, but what we do see in some of the beginning research is that partners, particularly male partners, are very likely to really not seek any help for their trauma, because, and if you think about it, that makes sense, right? In the early postpartum days, especially if the birth was harrowing or had a big emergency, the birth partner is like, thank God my family survived. That's all that matters. And now I'm just going to serve them, right? I'm just going to center them. I'm just going to like get them what they need, because whatever I'm going through is nothing compared to what my partner is going through, and my baby needs me. So what I need is just going to go on the back burner, right? And so they really feel this sense of like, I'm going to just keep quiet what I'm experiencing. And what I've seen happen is that has an expiration date. They can kind of push through for a while. Eventually, that pushing through comes at a cost, right? The bill comes due. And so the reason I bring this up is because sometimes some, birthing people will have trauma, and then like 6 months later, they'll be like, what's their problem? What's my partner's problem? Right? Because their partner's just been like, let's put it behind us. Let's put it in the past. It's not a big deal. Don't ruminate on it. Stop talking about it. Let's put it behind us. And so there's this disconnect in communication where it's this light bulb moment for the birthing person to be like, oh, my partner was traumatized, and that is why they're trying to shut down this conversation. Light bulb, right? What I've seen is sometimes partners, it goes in all directions. Sometimes partners have zero trauma while the person who gave birth has trauma. Sometimes they both do. And then sometimes the partner or the support person has more trauma, because sometimes, depending upon the circumstances, they heard more, they could observe more, they felt more of a sense of powerlessness, right? They're kind of pushed aside or out of the way. They can't help. The person who gave birth is going through a very different experience than the person supporting them. And sometimes in terms of trauma, that can change how they experience it. So that's a big plug for absolutely it can affect things. And it's huge gift to the couple as they are like adjusting to parenting, when they can realize like, oh, we're both traumatized. That's what feels off. And then good news, because that's very treatable and we can actually get back on track in a very short amount of time. Okay, so here's the other thing. I started out like focused on the birth trauma aspect of it for the person who gave birth and their partner. I ended up becoming a certified doula so that I could attend and be bedside. And so I have been doing that for about a decade now, attending births. And I had this moment where I was attending the birth of somebody that was really special to me. And the person who was attending them saw a particular presentation, I won't say just for, privacy. And their attending provider, who happened to be a hospital midwife, suddenly completely changed, demeanor completely changed. And I knew exactly what I was looking at, because I look at it all day long. She was having a trauma response, and I could recognize it plain as day. And I'm like, I can't believe this. I tried all my tricks, right, in my little bag of like trying to get her back, trying to get her to engage, but it did not matter. I could see that she was having a trauma response, and I could see that it was impacting how the interactions were going and some of the decisions that were made after. That was my second like specialty that chose me, right? This was almost a decade ago. I was like, what did I just see? First, I'm going to go do my own therapy for that birth because that was gnarly. Now, what was that I just saw, right?
Yep.
And what it led me to realize is that the people in the room, the midwives and the nurses and the OBs, have very high rates of PTSD from their work, either because of something they witnessed, because remember, they love and care for these patients, right? And so just statistically, if you practice long enough, you're going to be in a birth that, went sideways.
Yep.
The other side of it is sometimes they have trauma from what they've experienced directly. Sometimes they're in a space where what they are experiencing, the treatment they're getting also is traumatizing. And so what I found is that this is what it, so part of the reason I started teaching classes to professionals is because how are we going to make this whole system trauma informed when the people at the top of the system are completely traumatized and nobody has any plan for that?
Totally.
Other than like, suck it up and drink some coffee and get back in there, champ.
Yep.
Right.
Yep.
So for me, what I realized is when we're in the birth room, there's like a lot of reason for everyone there to be given so much love, so much compassion, so much support to recognize the humanity in all of us in the room, right? If you're a birth worker, in your colleagues, right? If you're a patient, in the providers and nurses, and if you're a provider and nurse, in the patients and in your colleagues, like recognizing that there's something happening that's more than just what's happening in this exact moment. Yeah.
Which I think is a good reminder, because I will say, like, I really believe, and we function, both of us, that like our care centers around the family giving birth, right? But also sometimes you may have a care provider that treats you a certain way or responds a certain way. And I will say, like, from my personal experience of being a nurse at the bedside, 1,000,000%, I have had, now I don't currently, because I'm not practicing in the hospital anymore, but at the bedside, I had traumatic responses, and I will be the kindest, most loving, most slow to whatever. And then all of a sudden it's like, I can't carry on a conversation with you because I'm doing, trying to keep you safe. But what that can translate sometimes to for the patient is, this nurse wasn't listening. I didn't exist, when like you very much exist, but they're having a traumatic response. Nurses, if you are identifying with any of this, one of the stories that I tell all the time is I would have an emergency and it would be stressful. And I would have, sometimes you're over for 6 hours charting on a case that just was wild. And then you come back the next night, and there's any little remnant of anything near that previous experience. And I am not one to hit the emergency button, but I hit that button. I remember one particular case where, like, for the next 3 or 4 shifts, like, I was pressing the button like 4 or 5 times a shift.
Oh, honey.
Like, no reason. I'd be like, and like, I'm a lot more jumpy, a lot more responsive, a lot more like, oh my God, whereas like normally in everyday life, like, I'm not pressing the button for that kind of stuff.
Yeah, absolutely. So, I've had providers in my office for exactly that reason. Some of them even having trauma from their own birth.
Yes.
They gave birth, something didn't go as planned, and then now they're attending birth a matter of weeks or months later, right? And now they're pushing, team buttons, like every time it starts to look like the thing that happened to them. Like, the thing is, our brain is, it's so precious in that it's like trying really hard. It's like, oh, the scary thing is happening again. The scary thing is happening again. And we'd rather, if we're going to make a mistake to being like overreactive than underreactive, right? It's like our caveman brain, it's better to think a stick is a snake than think a snake is a stick, right? And so our brain is just like more likely to want you to overreact than underreact, because overreacting, it thinks, is going to keep us alive. But when you're in your workplace repeatedly, like, that overreacting can be so painful, right?
And stressful to the patient. The poor patient, when there's 16 people popping in the room every 2 hours, when I'm like, I'm really sorry. I want to keep you safe. Like, it's coming from a really beautiful place, but there's trauma. And so I think it's important for families to just recognize this is a thing. And like, maybe in moments, like, be a little more gracious to the team, knowing that they're struggling a lot of times as well. Again, that doesn't mean your care doesn't center around you. And that doesn't mean that, like, how you're treated doesn't matter. Oh, well, whatever, they're traumatized. Like, no, that's not what I'm saying, but it's just a level of like understanding where we can all work together in a more beautiful way. And then if you're a provider, if you're identifying with this stuff, we have a class for you. This is, in the description I have, it's like Krysta's and our love letter to you, because there is hope for you in that way. And I will link it down below. It's called Healing Trauma in the Birth Professional. So that's a plug for that, because we don't have time for like a 2.5 hour class for that, for you professionals, but because we care so much and because your care matters for those of you birthing families that are listening, that like, it matters that your team is healed from this stuff. It will affect your care. And so it's sort of like, if you can start here, it's going to trickle down to the hundreds of families that they're caring for, and hopefully help prevent the trauma and them being a reason for the trauma in the birth room.
Yes. Yeah. We are like on the verge of, I'm convinced we're on the verge of a massive trauma-informed revolution in this space, top to bottom, the whole thing. And that's the way it's got to be, right? Like, I've seen so many professionals who are like, teach me how to be a trauma preventing nurse, but like, we won't talk about what's going on for me, and the truth of the matter is, when we as caregivers and as healing professionals are taking the time to make sure that like our house is in order, then suddenly, like, when we see someone in front of us who's having a trauma response, we recognize, we know how to respond. We know what resources to give them. We know what reassurance to give them. We know what to do from here, because it's a path we have walked ourselves, right? The patients win in the end and the families win in the end. And that is who this is all centered on.
Mm-hmm. Yep. Okay. So let's pivot back to the family. So let's say you're prepping for your birth, and I'm anticipating my birth. So there's the anticipation, and then there's the actual birth. I feel like I'm traumatized. What are your suggestions for people? How do they set themselves up to avoid trauma? Mm-hmm. And if they're on the other side, what are your suggestions for healing going forward? And then we'll kind of wrap up and come back with some techniques.
Okay. So here's my plug. If anybody has option to get a birth doula and you're thinking about it, do it. It's not been extensively researched, but my clinical belief in the research I have read is that it's very protective against trauma for multiple reasons. One of which is that you have the opportunity to debrief your birth with somebody who knows what they're talking about and was there, which you don't always get in a hospital system. That's huge, right? That empathetic listening ear, somebody who has a relationship with you before you walked in the room that day and knows what's important to you and knows how to communicate with you and doesn't leave your side. Huge, right? So if you're on the fence, I know that's not accessible to everybody. If you're on the fence about considering it, I really encourage you to consider it. The second thing is this, and this one is, I think, some of my favorite research, because there's this idea that the way to prevent trauma is to sort of be like, la, 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 about the whole subject.
Yep.
Right? That
I think that's the case with anything mental health, any struggle.
But especially in birth, because you don't want to hear people's trauma dump, right? And so you're kind of like, happy thoughts, happy thoughts, happy thoughts. And I was the same way with my first pregnancy. Like, I'm trying to think happy thoughts and relaxing thoughts, and I'm trying to not go there. And there's a little bit of a preconception of like, oh, trauma happens to people who are a little bit uptight about this, right? So I'm going to be chill and I'm going to be relaxed. Guess what? The research says the more prepared you are for birth, the less likely you are to have trauma. Mm-hmm. So the more books you read, the more videos you watch, like Sarah's, the more classes you take, like Sarah's, the more that you prepare for this process, the less likely you are to have trauma. It helps you speak the language of what's happening in the room. It gives you a context for what's normal, right? It helps you have alternative backup plans if things don't go how you expected.
Yep.
Right?
That's the whole reason why I started Bundle Birth, by the way, was to help avoid trauma.
Yes.
And birth memory is one of my taglines.
Mm-hmm. Yep. And so to that case, what we know is that if you're somebody who tends towards being very fearful of your birth for whatever reason, the things that you are most afraid of, you should set up a supportive opportunity for yourself where you have what you need to support yourself to prep. Right. So for instance, if you're like so afraid about, let's say you had a traumatic cesarean and you're so afraid it's going to turn into repeat C-section, at least one time, be with your birth team and make a plan. What are we going to do if it does go there? And then tuck it out, write it down, tuck it away. Yeah. Don't think about it anymore. But literally the more preparation you do, while this is what's interesting about the trauma brain says avoid. avoid, avoid, avoid. But actually, the more prepared we are, the more we're protecting ourselves. Because if that thing does happen, it's no longer the scary boogeyman. It's just plan B. And you know what's going to happen next, right? And you've regained a sense of feeling in control of your environment and feeling like you understand what's happening and feeling like people are still honoring your wishes, even though it's not plan A, it's plan B. And so that's all really protective.
Interesting. Cool.
Yeah. Yeah.
All right. So I'm traumatized.
Yeah.
I'm having symptoms. I'm listening to this and going, yep, 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 yep. Or like maybe a little bit, yep, but I'm curious.
Mm-hmm.
What are your suggestions for the person who's already on the other side of their birth?
So yeah, earlier we talked about, the things you can do in terms of moving your body, making sure you're eating, making sure you're sleeping, making sure that you're talking to people. And those things are so helpful. Again, in that window of 4 to 6 weeks, try to make sure that those things happen. And again, that's why doulas are awesome, because they often help with a lot of those things, making sure that they're happening for you or offering the support you need to make them happen. So that's my little plug there. But let's say that either that's not enough, you don't have that support in your world, or it's been longer than that 4 to 6 weeks. What we have seen is that after that 6-ish week window, your brain has kind of decided what it's decided about the experience. It's kind of not going to be tricked about it. It's like, nope, that was trauma. We've decided it's trauma and it's going to stay trauma unless anything is done about it. And what we've seen after that window of time is that the rates stay pretty consistent. And the only thing that the rates of trauma, and the only thing that changes is that people get better at avoiding their triggers, right? So they like take a different route to school. They like don't go to the dentist. They, don't go to the pediatric appointments. They don't look at pictures of themselves pregnant, whatever it is. They get better at avoiding triggers. But the reason we say that it's consistent is because if a trigger is introduced, they have the same response, and it doesn't matter how much time has passed. So if you're finding yourself in that window where it's been a while, and now anytime a cue for the experience or a trigger comes up for you, my strongest endorsement is a technique called EMDR. It's a therapy technique. It stands for eye movement desensitization and reprocessing. There are other options. This one's my favorite because it has the most research behind it at this point. And it has about an 83-ish% cure rate in 3 sessions for people that have like a single incident trauma. So meaning like
what?
Three sessions later, 83-ish% of people will have no more trauma after 3 sessions of that. Which is, again, like what we've been able to do is incredible. There's other frontiers of trauma research that we're still waiting to see that, I think we're getting even better and better and better at treating this, but that's still my favorite for this moment. Backup would be brain spotting, works on a similar function, but not as long researched. And then from there, I'm a big fan of anything that includes the body. So we know that you can do like trauma-informed yoga is helpful. But it has to be trauma-informed. We know obviously moving the body is helpful. We know breath work is helpful. There's other therapeutic techniques called like somatic experiencing and things like that. But what I would encourage you to look for when you're looking for any kind of support, therapeutic or other, is that you're looking for people who understand that you cannot talk trauma away. You're not going to talk it and it disappears after that 6-week mark.
Yes.
You've got to trick the brain into reprocessing it. And there's a bunch of ways to do that, EMDR being my favorite. And so actually this is why I opened like a counseling center, because I just could not keep up with the demand. People would like listen to me talk and be like, please help me. And I'm like, I want to help you, but I can't see anybody. So I've opened Dancy Perinatal Counseling. So if you're in California right now, we can do individual therapy. If you're nationwide, we're offering support groups, including an upcoming support group for traumatic birth that we're going to launch soon. So there's some options there. But if you don't have that near you, what you can do is look up these like EMDR, brain spotting, somatic experiencing, trauma therapies, trauma-informed yoga, those kinds of things you can look up near you as well. It's not like, there are a lot of people offering this.
But not everybody offers this.
Correct.
So you need to find a specifically trained trauma therapist, like yourself.
So specialty training, this is a really important point. Specialty training. So when we like graduate as therapists, we have like a general education, right? Like we have a general education in a lot of things. Yeah. So it takes specialty training to understand postpartum and pregnancy related mental health. And it takes specialty training to understand PTSD. Right? Think about all the different things that therapists can do, like addiction, medicine, anxiety, whatever. Like there's infinite options of specialty. So these are 2 specialties, and it's often hard to find a therapist who does both. And if you find a therapist who does both perinatal and trauma, they're often very full because there's a lot of demand for this.
Yeah.
And so when people will be like, I can't find that near me, or I can't afford that, or I can't, whatever, they have a wait list or whatever it is. If you have to choose, my recommendation is if you feel pretty confident you have trauma, then you have to choose a trauma therapist who's willing to believe you about your traumatic experience related to birth, because the traditional techniques for perinatal and postpartum mental health are related to more traditional therapeutic techniques. For instance, postpartum depression needs a different approach than trauma, right?
Yes.
So I would take a trauma therapist who's willing to apply it to your particular experience. That would be my recommendation if you're struggling to find options. Yeah.
Love it. Any final words for them for this part one?
Yeah. So I hope what you get from this, I mean, I love like the research, obviously, and like the nerdy data part of it, but I hope what you took from this more than anything is that this isn't something that you have to be scared to approach, scared to talk about, scared to ask for help for, because it's literally just a central nervous system response, right? You can be grateful and have trauma. You can be strong and have trauma. You can be optimistic and have trauma. These things are not mutually exclusive, right? Just like you can have any other central nervous system response and have trauma, right? They don't compete with each other. So I really want you to feel like this is preventable, this is treatable, and there's so much reason to have hope and ask for support and help in this issue, because really we've come such a long, incredible way in the last few years. There's so many opportunities for you, and there's so much hope for you.
I love that message. And that to me is one of the reasons why I love you so much, is because I think I've done a lot of work in this area. I've been to a lot of conferences and a lot of like PMADs situation, like perinatal mood and anxiety disorders, like anything kind of mental health related in the perinatal period. And I feel like this is the most hopeful I've felt about the future of families, and especially with the mission of avoiding trauma and then helping you recover from your trauma so you can live full, thriving lives with your families in like such an important season, which is giving birth and becoming a parent and continuing to become a parent. That I think I love that message, because there is hope, and you don't have to live this way. If you are struggling, this is not the end. There is so much available to you. And I hope that this was an opportunity for you to go, oh, what? Hold on. And then continue to take the next necessary steps to help either process the trauma and or get treatment for it, so that you can really bond and live those full, enriched lives.
Yes.
So with that, thank you all for being with me here today. Thank you, Krysta, for being here and just offering your wisdom and your knowledge to this audience. If you want more, make sure you subscribe down below, because we are coming back for part 2, and we are going to actually try some techniques related to coping with what we're going to call stress, but it's really trauma. That if you are struggling with panic, anxiety, trauma, stress, how to do some of these body-based techniques. So make sure you subscribe down below. Make sure you follow both of us on Instagram over there. Everything's in the description box down below. And then with that, don't forget to flex and flow, and we will see you soon. Bye.